often say a woman's capital is her good health. Doctor, what can you say about women's health?
Yes, actually, women are the pillar of the family. So, the health of the women is very important. So, the care given to the women is the prime importance. So, in medicines, the women's health is given more importance. So, now we can see the common diseases which affects the women.
Okay. Nowadays, common disease that we are facing in our day-to-day practice is PCOS, hormonal fluctuations, white discharge, polymenorrhagia, that is overbleeding, then leads to infertility also.
Okay.
And also like dysmenorrhea, adenomyosis, endometriosis, cervical cancer and breast cancer. So these are also a common conditions which affects the women. So these mainly involves physiological changes like endometrial thickness. So increased endometrial thickness will leads to the menorrhagia conditions, and increased ovarian size leads to the PCOD, and the cervical mucus thickening leads to the cervical erosions, and fallopian tube blockage leads to the infertility. So these are the common physiological and anatomical changes which affects the women.
Nowadays, ladies are facing lot of physiological and psychological issues. As day by day, their hormonal fluctuations is changing. So we have to say women are suffering a lot. So we have to correct them through the line of treatment. So first we used to do this, correct the Kutra dosha. Usually Vadam is the most affected in ladies cases. So what we use that, there's a verse in Tamil that Virejanathal Vadam Thalum. So first we used to give purgative medicine. There are a lot of purgative medicines, but according to the condition and the symptoms of the patient, according to the temperament, through Nadi diagnosis, we used to give medications. For example, we have Nilapaki Churnam, Triphala Churnam, then Kalingadi Thailam, Malayam. A lot of medicines are there for purgative treatments. And followed by that, we used to give internal medications like Ashogapatti Churnam, Nirakadamba Churnam, Padigalinga Chenturam. So and so medicines are there.
This is used for strengthening the.
No, we are giving the medications to correct the problems. Depending upon the conditions and symptoms, we vary the medicines.
Okay.
Yes, adding to that point, like menstrual menopausal time also it is important. So during menopausal time, women are facing psychological issues also, like mood swings and dryness over the body, and hot flashes, and so for these symptoms, we will be giving medicines like Manasamitra Vadakam, then Ashokarishtam, and Shatavarigulam, Ashwagandha Churnam. So these are given. And adding to this, like during a menarche time also, the women will be facing dysmenorrhea. So for that also we are advising Shatapushpa Churna, Saptasaram Kashayam, Rajapravatni Vati, and also external treatments, like specifically it is mentioned in Ayurveda, like Sthanika Chikitsa, a special treatment given to the special place, that is uterus. So like Uttaravasti, Yoni Prakshalanam, and Yoni Pichu. So Uttaravasti means a medicated thaila or ghee is given to intrauterine, that is inside the uterus, and extrauterine in the vagina also. So this is mainly indicated for infertility conditions and tubal block. Second is the Yoni Prakshalam, that is vaginal douche, is mainly given in the white discharge conditions and some infection conditions. Then third is the Yoni Pichu. So the medicated oil is kept over the vaginal wall. So this is for like cystosil conditions, uterine prolapse. So these conditions, these Sthanika Chikitsa are used.
Okay. For Siddha, is there any external treatment?
Yeah, we have Pichu. Pichu means internal douche. We are using Triphala decoction as a Pichu. And then we are giving oilations like ghee preparations for correcting the endometrial thickening and everything. And for PCOS, we used to give purgative medicine and also some Pichu pertaining to some medicines.
So, and including internal and external treatment, we have to include patya, apatya, and viharam also, like diet and lifestyle modifications, for especially for women's health. So, while coming to the diet and lifestyle modification, mainly the food which increases the pitta dosha should be reduced for all these menstrual irregularities and psychological problems. Then, like coming to the lifestyle modification, like activity is more encouraged. So, yoga, pranayama, it's also advised for this hypothalamo pituitary ovarian that imbalance.
Doctor, can you give us some health tips for our women?
Definitely. Nowadays, ladies should be more aware about their health. So first they have, from the adolescent period, they have to first monitor their menarche, that is menstrual flow. They have to check how much blood is going, how much pads they are changing, and they have to check their breast examination daily. They have to follow their dryness or vaginal discharges there. They have to take a healthy lunch. That is the main thing. A balanced diet with a healthy lunch includes of fresh vegetables, fruits, and they have to add more leafy vegetables like kira. In Siddha, there are a lot of varieties of kira is mentioned. So, balanced diet keeps a woman healthy.
Yes.
And another thing is that they have to keep their hygiene proper. Main thing is that nowadays, personal hygiene. Nowadays, school going children, what they are doing is that they are avoiding the toileting. So day by day infections are getting, so they are prone to fungal infection more. So they have to be very cautious about their health hygiene. And leading to that, we have to go to psychological issues also. We have to reduce the mental stress. We have to do what all things that makes us happy. That is the main thing. Each and every person is different. Some persons like music, some persons like dance. So whatever things we makes them happy, they have to do, and they have to follow regular exercise, and leads to yoga, like that therapy they have to go.
Yes, in activities we have to do yoga daily, like asanas like Surya Namaskar, like 7 to 9 times daily we can do. It helps the reproductive health. Then like Bhadrasana and Shashangasana, it is help for infertility health. Like fertility health, it helps. Next, like walking for half an hour. So these activities will help for women's conditions.
So listen up, ladies. You are the backbone of your family. So take care of yourselves.